Does internal migration limit access to specialized healthcare services? Imagine moving across the country and suddenly finding that your usual doctor or specialist is no longer nearby. That's what internal migration can sometimes mean for access to healthcare. When people move within the United States, their ability to get specialized medical services depends on where they settle. Specialized healthcare services are usually found in big cities or regions with major hospitals and clinics. These areas have more doctors who focus on complex conditions like cancer, heart disease, or rare illnesses. If someone moves from a rural area to a city, they often gain better access to these services. But if they move from a city to a less developed area, they might face fewer options. The distribution of healthcare resources is uneven across the country. Urban centers tend to have more hospitals and specialists, while rural regions may have limited facilities. When many people move into cities, hospitals can become crowded, which might slow down care or limit appointment availability. Conversely, areas losing population might see hospitals close or reduce services, making access even harder. The characteristics of migrants also matter. Younger people or those with good insurance are more likely to seek out specialized care. Migrants who lack insurance or have lower incomes might not be able to afford these services even if they are available. Language barriers and cultural differences can also make it difficult for some migrants to navigate the healthcare system and get the care they need. Immigrants and internal migrants often work in healthcare roles themselves. Many are nurses, doctors, or support staff. However, some skilled immigrant healthcare workers face barriers like licensing issues or credential recognition, which can limit their ability to practice fully. This can indirectly affect the availability of specialized services in some areas. Healthcare policies and state rules also influence access. When people move across state lines, they might encounter different insurance requirements or healthcare programs. Some states expand Medicaid or have specific programs to help migrants access care, while others do not. This variation can create gaps in service availability for internal migrants. For those moving to underserved areas, limited access to specialized healthcare can mean delays in diagnosing or treating serious conditions. This can lead to worse health outcomes over time. To address this, efforts like telemedicine are expanding, allowing patients to consult specialists remotely. Improving primary care networks and addressing social factors like transportation and language help make healthcare more accessible for all migrants. In the end, whether internal migration limits access to specialized healthcare depends on where migrants go and the healthcare infrastructure there. Moving to a well-resourced urban area usually improves access, but moving to rural or underserved regions can pose challenges. The interaction of geographic location, individual circumstances, and policies shapes the healthcare experience for internal migrants across the country.